Joining us now, epidemiologist and professor at Boston College's Connell School of Nursing, Dr. Nadia Abuelazam. I'd like to point out from what we just saw that we had these nurses and these professionals in the White House, frontline workers, not wearing masks and not 6 feet apart. Obviously in a very nervous situation with the President of the United States, and have the President run over them. Dr. Abuelazam, are you hearing reports of tremendous supply of PPE?
From my understanding of what's happening here at local Boston hospitals, many of the larger hospitals with resources actually have supplies of PPE. It's really the smaller hospitals, the community-based hospitals, those that are providing outpatient care that may be struggling to maintain their supplies. I've also heard that hospitals have been getting creative with ways to sanitize their masks and make sure that they have enough supplies for their frontline workers.
With your experience, obviously with frontline workers, but also epidemiology, what do you feel about businesses reopening in the next few weeks in certain parts of the country?
It does make me a bit nervous that we're reopening a bit too soon. What we're seeing in many states is actually still an increasing number of cases and an increasing number of deaths. And this suggests that we're not really through the worst part of this epidemic yet. So it's really concerning that some states are going back to normal. It does suggest that we may see an increase in the number of cases in these states in the next few weeks. Of course, those cases will actually lag behind the reopening. So it may seem that everything is okay for a week or two, but then the numbers may start rising. And that's really what worries me about the situation.
How much would rapid testing change our ability to reopen safely?
I do think that the reason why we've been in lockdown, there are a number of reasons. One is to allow our healthcare system to keep up with sort of the demand. But another reason is really hopefully been to buy a little bit of time to start improving our testing capacity, start improving our capacity to contact trace and isolate people who are positive. So certainly an improvement in our testing, whether that's sort of quick diagnostic testing, or whether that's just simply providing a landscape of test, trace, and isolate. I think these are all things that we should be thinking about improving during this time of lockdown. And as you've mentioned, some states have decided to move out of lockdown without that supply chain and also without a system in place to try to prevent new infections and spread in these areas.
Yeah, Willie, I'll throw it to you, but just highlighting some key points here that most experts that we talk to say testing gets us back much more safely, especially the rapid testing. And again, driving it home here, the reason we are in lockdown is to buy time to get our act together on testing, and yet the president refuses to invoke the Defense Production Act to get it together more quickly in a more uniform, organized, coordinated way. So we are stuck in lockdown because we don't have our act together on testing, and this president refuses to do the one thing that could make it actually more effectively happen.
Yeah, and governors across the country have called for a national program because it is an ad hoc system going state by state trying to get people tested. Doctor, I want to ask you just for your opinion as an epidemiologist who's looking at this and kind of taking maybe a little bit longer view than a lot of people who are trying to survive the day and get back to work. I know a lot of families are thinking this summer about whether or not their kids are going to summer camp, whether or not they're going on vacation, whether or not even in the fall their kids may go back. How are you looking at sort of the scope of this and the spectrum of this, how long it may last, and how optimistic are you, say, that kids will be back in school in the fall?
Yes, I think a lot of this, again, depends on the system that we can have in place to be able to test people, to be able to contact trace and make sure we're protecting all of the potential contacts, to be able to isolate people, and then also to be able to treat and support people. So really, the timeline is going to depend on our ability to get that system in place. I do think that this is going to be a bit of a longer lasting epidemic than people might be expecting. I think that people should really plan to maintain social distancing for a bit longer, especially to protect their families, to protect the vulnerable in the population. So in my perspective, I don't see this epidemic ending anytime soon. I do think that a vaccine will really be needed in order to make this sort of an official stop, have an official stop to the epidemic. But again, the system needs to be in place. We need to be able to test, we need to be able to trace, and we need to be able to isolate. And until that happens, I'm not sure that it would be really safe to go back to all of our normal activities.
So what would change that trajectory in your mind? Would it be a national testing program? Because as you suggest, you're not alone in saying we're not on that trajectory right now. We're not testing nearly as much as we would need to be to get kids back in school in the fall. So what would you like to see as an epidemiologist if you had your wish list? What would happen this morning to make that happen and make it possible for people to go back to work and eventually go back to school?
Sure. I mean, I think it's really important to note that before this epidemic began, unfortunately, our public health system was underfunded and, in fact, defunded. And so really, we need an investment in public health in this country. We need an investment in a national testing campaign. We need an investment in contact tracing supplies. That involves a huge amount of human resources or digital technology. We really need investment in the public health pipeline. And I think that that is going to require strong and effective leadership that's really invested in, again, this campaign of test, trace, and isolate.
Dr. Nadia Abuelazam, thank you so much. Please come back. We really appreciate it. And
thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.